Hello, everyone. Welcome back. I'm Steve. So, today we're going to be talking about the nationwide lockdown. Now, yes, I understand most places are not locked down nationwide. Like, it's not national order, it's basically Lagos, Abuja, and Ogun State. I understand that. But for the most part, most states are actually carrying out these measures. That is, these measures are being carried out by most states. Ondo State, Osun State, wherever you are, basically everywhere is getting locked down right now. Edo State, it doesn't really matter. So we may as well just call it nationwide lockdown. So that's it. So the major thing I really want to mention is that we need to understand the reason why this thing is being done. Now, most people just think they are being prevented from earning their livelihood, from going out and earning money to, survive, like in Nigeria, to survive, you understand? So that's the main thing. So many people just think this thing is being overblown, like it's getting way too much. Like it's not warranted at all. So that's what most people actually think. But the reason why we are doing this is to limit the spread of the virus. Now, it's not just about limiting the spread. I mean, you could just limit the spread by making people social distance, social distancing, wash your hands, clean up as much as possible, make sure you don't sneeze into your hands, don't cough into your hands, all sorts of measures like that. Don't shake hands. It's true. But for the most part, if people are staying away from each other, it helps to reduce the contact that people have with one another because this thing spreads from human to human. So if we're able to reduce the rate at which people connect together, then we are going to reduce the possibility that our healthcare system is going to get overwhelmed by this problem. Because honestly, for most countries, check Italy, check Spain, their healthcare systems have gotten overwhelmed by this problem. I mean, it gets to a particular stage where there are not enough hospitals to admit these people. There are not enough ICU beds, that is intensive care unit beds, to admit these people. There are not enough ventilators, that is the oxygen mask sort of thing, to admit these people, to help them to survive. That's why you're going to start having a lot of people dying because the required facilities necessary to keep them alive, especially for those people that have the worst case scenario, those people with the severe symptoms, because about 80% don't have severe symptoms. You're just going to have mild symptoms. You're going to think you have just cold, you are just having the case of the sniffles, the flu, just sneezing and all of that, coughing. But for those 20% that are going to have serious symptoms, it's going to lead to more people dying if there are not enough intensive care unit beds on ground and facilities. That's what has made Italy's death rates to skyrocket so much, like so much. And the same thing in China, the same thing in other places, because the healthcare system got overwhelmed by the problem. So we don't want a situation like that. It's one of the reasons why we're doing this. So in fact, I can even say more than the limiting of the spread, the primary thing is that we don't want this thing to overwhelm our healthcare system. So what we're trying to do right now is that we want to make sure that we slow down the spread, and then we create enough healthcare system facilities on ground so that by the time people go back to work, because it's going to be inevitable, by the time people go back to work, people are going to start spreading this thing again. Honestly, the remaining number of people that still have it then are going to spread it all around again. Of course, for the most part, people that have already had it are not going to get it anymore because the virus is not evolving so much. So you already have the antibody in your body if you already had it. So it's most likely that you're not going to get it anymore. It's almost like the chicken pox. You've had it once, you're not going to have it anymore. You already have the immunity against it. So that's the way it is. But a lot of people that did not contract it the first time are going to start contracting it the other time. So we don't want a situation where the number of people that are going to be contracting it then suddenly spikes and the number of the severe cases spike also. And then we are going to have the healthcare system collapsing under the weight of the entire thing. And then people are going to start dying because there's no way to care for them. We don't want that to happen. That's the reason why we are doing the lockdown right now. So I guess that makes sense to everybody. So also one of the reasons is that we don't want a situation where people that need severe or that need serious healthcare from the hospitals are going to be turned away. We don't want people with severe cases of malaria. We don't want people with severe cases of typhoid. We don't want people with severe cases of heart attack and all sorts of illnesses to not be able to get the healthcare that they want simply because everywhere has been overwhelmed by coronavirus disease. We don't want a situation where everything has been overwhelmed by the coronavirus and then People going to the hospitals can't get help. They can't get bed to be admitted, to be treated. They can't get doctors to attend to them because basically all the doctors are attending to coronavirus. And then it's going to become more difficult for them to attend to regular patients because those patients are even at risk now. They might even contract something else while they are going to treat themselves on something different. So we don't want that kind of a situation. That's the reason why we are doing this. Honestly, that's the reason. And again, please obey the lockdown in your area. Follow the guidelines by your local government, by your state government, by people in charge in your area. Follow the guideline so you can be safe. As much as possible, follow it. We have about 111 cases right now in Nigeria. And of course, that means tested cases. It doesn't mean that we have only 111 cases in Nigeria right now. More likely, I think most likely, we have a lot of cases, like so many more cases. The tested cases just means that, okay, they tested a group of people that were suspected and they discovered that 111 people have it right now, confirmed. So that's the way it is. Just like you're testing people in a particular neighborhood and you discover that about 111 of them have HIV, that doesn't mean that everybody in that town, out of everybody in that town, we have only 111 people that have HIV. It's only those people in the neighborhood. So the neighborhood in this case is actually those people that were suspected of having the disease and then they were tested. Honestly, we have over 4,000 people right now that have had contact with some of these people and we don't even know where they are. So those people, if some of them, let's say half of them already got the virus and they already spread it all around to so many other people, only God knows the number of people in Nigeria that has the disease right now. So honestly, make sure you practice the social distancing so that you don't worsen the case for us. Thank you very much. I'll be seeing you guys in the next segment. Make sure you subscribe to the channel, like the video, and share with your friends. Next time.